Hi, I will be introducing flap surgery, also known as open flap debridement. Flap surgery is a periodontal procedure where the gingival tissue is carefully lifted to expose the tooth root and alveolar bone. This gives the clinician direct access to deep periodontal pockets that are difficult to treat with non-surgical therapy alone. The main purpose of flap surgery is to improve visibility and access. With the flap reflected, the clinician can remove subgingival calculus by biofilm and inflamed tissue more effectively. It also allows better evaluation of the alveolar bone and periodontal defect. Flap surgery is usually considered when scaling and root planning are not enough. It may be needed when the periodontal pocket remain bleeding on probing or inflammation continues or when the area is difficult to maintain due to furcation involvement or complex root anatomy. It may also be used when vertical bony defect need further evaluation or when additional treatments such as osseous surgery or regenerative therapy may be required. The procedure begins with reviewing the client medical history, radiographs, and periodontal charting. After local anesthesia is given, the dentist or periodontist make an incision and reflect the gingival flap. Then granulation tissue, calculus, and biofilm are removed. The exposed root surface are scaled and root planed. The area is irrigated, and the flap is repositioned and sutured. Post-op instructions are given at the end. For our QR code, we chose the video that briefly showed the main step of the flap surgery. It demonstrates how the flap is opened to access the root surface, remove deposit, and reposition the tissue for healing. This helps explain why open flap debridement is useful for deep periodontal pocket. And for the outcomes of surgery, open flap debridement can reduce periodontal pocket depth, improve access for root debridement, and decrease inflammation and bleeding on probing. Overall, successful treatment support periodontal stability, easier plaque control, and long-term periodontal maintenance.
On this page, I will discuss the type of healing expected, dressing, and sutures, post-surgical extraction, and important points for dental hygienists following open flap debridement surgery. First, regarding healing, periodontal flap surgery can heal by either repair or regeneration. Repair restores tissue continuity but does not fully recreate the original periodontal structures. Regeneration is the formation of new cementum, periodontal ligament, and alveolar bone. Most flap surgeries heal primarily through repair, although regeneration may occur when regenerative procedures are or materials are used. The healing timeline is important to understand. The first postoperative visit usually occurs within 5 to 7 days, and a second follow up appointment is often scheduled within 2 to 3 weeks. Flap attachment to the alveolar bone occurs in approximately 3 weeks, while soft tissue remodeling may continue for up to 6 months. Sutures are used to stabilize tissues, control bleeding, protect the surgical site, and promote healing. Non-absorbable sutures such as silk, nylon, and polypropylene are typically removed 7 to 10 days after surgery. Absorbable sutures such as chromic gut, vicryl, and monocryl dissolves naturally and usually do not require removal. A periodontal dressing may also be placed to protect the surgical site, stabilize the blood clot, reduce postoperative discomfort, and support healing tissues. Clients must follow postoperative instructions carefully. They may be prescribed a coloxidine rinse and should avoid brushing the surgical area until instructed. Soft foods are recommended, and hot, hard, crunchy, or spicy food should be avoided during early healing. Patients should limit strenuous physical activity for the first 24 to 48 hours and take all prescribed medication as directed. Finally, dental hygienists play an important role in postoperative care. We evaluate healing, reinforce oral hygiene instruction, provide client education, and monitor for complications such as excessive swelling, persistent bleeding, infection, plaque accumulation, delayed healing, or gingival recession. Long-term periodontal maintenance is essential to help preserve the results of surgery. Here is our references. Thank you for listening.